Fellow citizens, residents, friends, and well-wishers, good evening. I promised you on Sunday that I would be returning in short order to continue our analysis of the impact of the coronavirus on Dominica. Since I spoke to you last, Dominica recorded its second imported case of coronavirus. Earlier today, I was informed by the Minister of Health that health authorities have confirmed 5 additional positive testings associated with one of the 2 cases already under observation. This brings to 7 the number of confirmed coronavirus cases in Dominica. This means that at least 5 persons are known to have contracted the virus as a consequence of coming into contact with in one way or the other, with one of the persons who was tested positive and who would have brought the virus from abroad. Fellow citizens, on-island transmission is very serious and very dangerous. It triggers many scenarios and possibilities. Our contact tracing continues, and there's a possibility that wider transmission could have occurred. We have no way of knowing this for sure until persons have been tested and the results known. However, as a nation, we cannot sit idle and wait. The established procedure on confirmation of on-island spread is for an increasing of the level of awareness and activity. I told you on Sunday, the imported positive testing took us to level 2. Confirmed cases of on-island testing now takes us to level 3. This is unfortunate, but it is not hopeless. In many respects, such is to be expected. That is why contact tracing is super important to the process. As a consequence of our going nationally now to level 3, there are certain concomitant adjustments that will have to be made. Firstly, we do not wish as a nation to expose ourselves to the possibility and probability of additional imported cases. We need to take hold of the situation as is and manage the cases we have, both those already identified and others we suspect will surface in the days ahead. Accordingly, the issue of border protection and border control comes sharply into focus. Several of my ministers and I, along with health authorities, met earlier today with the social partners. Social partners in this regard refer to the leadership of the private sector and business community, as well as hoteliers and others involved in the tourism sector, trade union leaders, the church, both government and opposition parliamentarians, and representatives of non-governmental organizations. We met as committed and concerned Dominicans, and we discussed the scenario and our options. It was agreed almost unanimously that we should move to protect our borders and contain movement to the greatest extent possible. Accordingly, I wish to announce this evening that the Commonwealth of Dominica shall suspend all commercial air and sea access to non-Dominicans effective Thursday, the 26th day of March 2020, and to all travelers, including Dominican citizens and residents, Saturday, the 28th of March 2020. This order relates to all commercial aircraft, as well as non-essential service-oriented pleasure craft. The same order of March 28th applies to ships, boats, and yachts not visiting Dominica for the express purpose of bringing vitally needed cargo and other supplies to this country. All air and sea arrivals must henceforth be granted permission to enter by the office of the Chief Medical Officer. This suspension shall remain in effect until further notice. Dominicans abroad wishing to return home in the short term should act now to schedule travel within the time frame of this order. The same applies to Dominicans and visitors desirous of leaving Dominica. You have but a short time to do this. Movement to level 3 also carries with it ramifications for social gathering, or as it is now commonly called, social distancing. Ladies and gentlemen, the coronavirus is contagious, highly contagious. It is spread largely through person-to-person contact, as well as from droplets left on surfaces and clothing. We need to minimize the spread in Dominica. Accordingly, I am today advising that with immediate effect, all non-essential gatherings in Dominica must be contained to no more than 10 individuals. Essential gatherings for the purpose of this regulation can be defined as workplaces, supermarkets, public transportation, bus stations, health institutions, and any other as might be permitted by the Chief Medical Officer. Non-essential gatherings would therefore include restaurants, churches, sporting and recreational facilities, gyms, cinemas, nightclubs, bars, and most government offices, including the financial center and the ministries of government. I wish to take up this opportunity to appeal to Dominican entrepreneurs to be innovative and creative in their response to these impositions. If persons cannot gather inside a restaurant, then introduce takeout or pick-up service. You may also consider delivery. There is no need for a cessation of business activity around the country. The issue is not the conduct of business. It is the gathering and social interaction of individuals. Therefore, I am urging you to come up with creative ways of conducting your business that would not involve persons gathering and endangering their lives, as well as those of your employees and even yourself. Employees, be wise. Wherever and however possible, prepare and pack your lunch at home. Place your order early and arrange for pickup or delivery. Do not endanger your health by congregating in large groups. This virus feeds on the spread of droplets from one individual to another. If no one is in arm's distance to you, then it is unlikely they can infect you. Ladies and gentlemen, we have said repeatedly the key to fighting this disease is the practice of good hygiene. Wash your hands frequently and thoroughly. Keep your hands from your face. Cough into a tissue and dispose of it right away. Sneeze into your elbow if you do not have a tissue immediately at hand. Please, let us minimize visits to seniors and to persons with pre-existing medical conditions. If you have to take something for Granny, leave it on the step and call and tell her it is there. Seniors, you should not put yourself in harm's way. Call for what you need and have it delivered to your doorstep. Do not hug people. Do not shake their hands. I know you love to go to church, but for the time being, listen to the service on your radio or watch it on television. Ladies and gentlemen, the measures I have outlined today and the growing spread of this virus in Dominica will have significant social and economic impact on our country. The economic losses shall be severe. All echelons of society will be affected. Employers, employees, and the dispense of social services. As a government, we will have to act to cushion the impact on the most vulnerable. We will shortly be embracing the social partners again to discuss the ramifications of all this on all sectors and interests in the country. Tonight is not the time for this. Tonight, I want us to focus on the harsh reality of what is threatening our social and economic landscape. In the days ahead, we shall discuss the fallout. Fellow Dominicans, coronavirus is real. It is a global pandemic. Nothing I have referenced this evening or implemented is unique to Dominica. Indeed, some may say we have been rather lenient in our stipulations. I have not imposed martial law because I know I have faith in Dominicans. You have weathered many a storm. I know you know when to pull together. I know you know when to fall in line. This is time for each of us to pull his or her weight. I do not want to go to Parliament to legislate and regulate behaviors. But trust me, if I have to, I will. This virus can be defeated. It can be contained and eventually eliminated in Dominica. There does not have to be a single fatality associated with COVID-19 in Dominica. The government of Dominica, through the Ministry of Health, is doing all in its power to contain the spread of this disease. We shall be shifting most activities away from the area or even proximity to the Dominica-China Friendship Hospital. We have in place a facility at Portsmouth that is equipped to treat patients who have tested positive. I have also commenced discussions with a provider to source a 125-bed transportable facility that can be erected in short order to house persons afflicted with the virus. Acute cases will be cared for elsewhere, but mild symptoms could be treated there. Upon our request, the government of the Republic of Cuba will be sending 25 nurses, 6 doctors, and 4 lab technicians to assist with our efforts. They will arrive on our island this Thursday. We will do all in our power to minimize the spread of this virus and to attend to the needs of those who have contracted the virus. Our healthcare officials are motivated and are up to the task. This is their area of specialty, and we shall take our cue from them. Whatever reinforcements they require, we shall endeavor to provide. This evening, I appeal to service providers on the front line to rise to the occasion and bring to bear to this assignment your many years of training and practical experience. I want the wider society to salute our frontline care providers. Keep an eye out for their children. Offer to deliver a hot meal to their senior relatives and dependents. If a doctor, nurse, policeman, or firefighter is out there on the front line, they cannot be at the same time in the village attending to their loved ones. I need society to take care of their own. Let us have the backs of the frontline essential service providers. Ladies and gentlemen, Dominica will defeat coronavirus. We wrestled Hurricane Maria to the ground, and we shall triumph over COVID-19. I have every faith and confidence in you, the people of Dominica. The government of Dominica shall play its part. We are working hard to attain and maintain adequate stocks of essential items. We are working hard to ensure that all medical supplies associated with the diagnosis and management of this virus are in plentiful supply. We are working hard to ensure that Dominica's rate of spread is contained. The government of the People's Republic of China is also assisting us with much needed equipment and supplies. I urge all citizens and residents to join forces in that fight. Put away differences and unite for a common and national cause. If we join forces against COVID-19, it cannot survive. Please, please, let us get out into the communities and look out for our seniors. Do not make them come outside. Run the errands for them. Go buy what they need and place it at the door. My friends, please continue to monitor only the official source of news on this matter. Where there is something to say, the government of Dominica shall say it. You do not need to forward everything you receive. The government of Dominica shall keep you informed with all that's going on. I propose to speak with you again on Thursday evening. Until then, take care of yourselves. Keep your distance. Wash your hands for at least 20 seconds. And even then, keep them away from your face. May God bless you all. May God bless the Commonwealth of Dominica, and may God bless all our efforts in this united fight against COVID-19 in our country, Dominica, and indeed the world. I thank you and good evening.